Hello, everyone, and welcome back to another episode of the Key Ingredient Podcast. Today, I'm joined by Naples plastic surgeon, Dr. Kent Hasen. Dr. Hasen, thanks for joining me today.
Thanks for having me.
Excited to have you on. We've never had a plastic surgeon on the Key Ingredient, and you're very well known in town here in Naples and the surrounding areas. So this is something I've been looking forward to for quite some time, and it's a great way for our viewers and listeners to get to know you better. If you don't mind, maybe just tell us a little bit about yourself.
Okay, well, I came down to Naples back in like 2002, so almost 20 years now. I grew up in Carmel, Indiana, a suburb outside of Indianapolis. And my parents had retired down here when I started residency. And I started kind of looking around Naples. And with my wife, we got married in my senior year of residency. And we looked at Chicago, but really liked the idea of trying to start a practice down here in Naples. So we did that, just kind of hung a shingle and kind of ground it out for the last 20 years. And now, we're here.
It's a little different than Chicago, isn't it?
Yeah, definitely.
Just a little bit, especially as a plastic surgeon. I mean, I'm sure Chicago's a great area to be in, but certainly down here, I would imagine with the growth that we're seeing in the area, it's probably a phenomenal place for you. So let's go back a little bit, because part of the Key Ingredient Podcast, part of the premise really, is to get to know the people we interview and get to know kind of what that key ingredient was and that pivotal moment in your life that kind of attributed to getting where you are today. So let's go back maybe to your earlier days, grammar school, high school. What kind of kid were you in grammar school and high school?
I was a good student, but I was the youngest of two older sisters, and both of them were like phenomenal students. One was valedictorian of her class, went to Yale for undergraduate. So she kind of led the way. I definitely was a good student, but just wasn't kind of, getting that 4.0 back in the 80s like that.
Sure. You must have been pretty good, though, to become a physician. But did you always know you wanted to be a physician, or what age did that kind of happen?
It was funny. I think at age 6, my mom gave me a stethoscope for I don't know, it was just some gift. And she would always thought my father should have been a physician. So he worked for Eli Lilly as a industrial engineer, but she was kind of just always wanted a physician in the family. So I liked that. Kind of gave me a little idea to kind of go that way, and then just did really well in sciences and math. And so I kept kind of chugging along with that in undergraduate.
Interesting. So was there ever a period of time, throughout school that you thought maybe you'd go another route? Were there other things that interest you? Were you into sports or?
Yeah, I was into sports, but not anything I could do professionally.
Sure.
But no, it was just really at IU, which I went to in undergraduate at Indiana University. I got into doing some teaching there as kind of a student teacher assistant and stuff. So it was neat to do I was in biology. It was my main major.
Okay.
And then in my junior year, I was taking Italian. I'm half Italian. My mom's a first-generation Italian. And I was taking Italian there, and the teacher was actually from Bologna, Italy. And Indiana had a consortium, kind of a year abroad program over in the University of Bologna. And she's like, "Oh, you should really try to go to this." And this is when I was a junior going into my senior year of college. And I was like, I'm going to be going into med school. Maybe I could use a year just to kind of broaden myself before that. And so came home, told my parents about it, and they were like, no, you're on track to go to med school. But I ended up doing an extra year. I came back and did my senior year, but I did that year in Italy, and it was just amazing to, and then I even got a second degree in Italian. So I had a bachelor's of art in Italian, as well as a bachelor's of science in biology.
So you speak Italian? Is it fair to say that, or?
It was fair. Not anymore.
Okay.
Because that was literally like 30 years ago. So
You don't practice it too much.
Haven't had a lot of chance to practice it. So
Sure.
I try, every once in a while I've been back a couple times to Italy, but just not as much as I'd really like to.
Yeah. No, I understand. So, okay, so you graduated. Indiana University.
Sure.
At that point, while you were there, you were taking obviously all the classes you needed for for medical school, and you were a biology major. So you took organic chemistry and all those really tough classes that they make you take.
Yes.
And so when you started applying to medical schools, what was you thinking? Was there certain type of practice you thought you might want to get into? Was it plastic surgery at that time?
It really wasn't. When I was first just going into medical school, I really had no like kind of mentors that were physicians. Nobody in my family was a physician, and what I'd seen growing up was basically just pediatricians, things like that. So I didn't really know what part of medicine I wanted to go into. I had heard of like orthopedic surgery because it was kind of cool with all the sports and everything.
Sure.
So what was interesting though is right before starting med school, my mom was diagnosed with breast cancer. And so she was like almost devastated, having to have a mastectomy. She felt like, she couldn't go on. And then she met with a plastic surgeon in Indianapolis at the time. And he, said, oh, we can reconstruct it right away. You'll be whole again and everything. And just that kind of motivation to her really made her get through that, and she's still here today,
Wow.
which is great. And so that kind of opened my eyes to the possibilities of plastic surgery.
Yeah.
And then when I went to Cornell, I kind of immediately kind of went into the plastic surgery department, met some of the people. They were all great, and got in to do research. In med school, you still have summers between like your first and your second year, and so I did like a 3-month NIH kind of granted scholarship of research with the plastic surgery department there, and then ever since then it was just kind of plastic surgery.
Sure.
Yeah.
Wow. That's terrific. That's a great story. Thanks for sharing that. So, okay. So once you graduated Cornell Medical School, so then you ended up in Chicago. Is that?
I did, yeah. So different ways of getting to be a plastic surgeon. Initially, it was usually to do like 5 years of general surgery, and then you do kind of like plastic surgery, 2 years of plastic surgery. They started to realize it was kind of a waste to do all of that training. You're doing, so much just general surgery and very little of the plastic surgery, and then that's what you're actually going to be specializing in. So it started moving away from that to more of an integrated program where you didn't have to get fully board certified in general surgery because it didn't make sense to go through all that. And so there was a lot of programs that were either 3 years of general surgery and 3 years of plastic surgery, or different things like that. So I went into one of the early integrated programs at Northwestern, which was 3 years of general surgery. But even in those 3 years, you're still kind of part of the plastic surgery, and you're getting rotations that are more important to plastic surgery than they would be to just the general surgeon.
Okay. So once you finished that up in Chicago, did you leave right away to come down here, or was there a span of time that you stayed there?
No, I did leave. I went down to Miami actually and did a cosmetic surgery fellowship down there. And so that was it was really nice. It was good to see kind of like how a real private practice works.
So did you work within a private practice, so someone else's practice you were working
Yeah,
in?
just still as a fellow though. So
Okay.
And it just kind of gave you an idea of like what is the real business, I guess, side of plastic surgery, and also a practice that's really concentrated, almost exclusively in cosmetic surgery.
I was going to ask you about the business part, and we could get to that a little bit as well. But is that something they teach you in medical school? I mean, I always find that fascinating as someone who's in business. You come out here, you are obviously a good student. You get through all these boards and exams and everything you need to do, and just a lot of schooling in general. And then you come out, and all of a sudden you're a business owner. So we'll get to that in a moment. So we'll hold on to that. So how long did you do that fellowship?
That was just a 3-month fellowship.
Okay.
Kind of get your feet wet with that. And during that time, I was basically starting to ramp up the practice here, like getting a place to practice, getting insurance, all the different things, a Florida license, everything you need.
Sure. So when you started the practice here, was it the same building you're in now, or
No.
It was different
Yeah,
location,
yes,
right?
different location.
So you started down here. How did you hire people? Did you hire one person? Did you have multiple?
I initially just hired one person,
Okay.
and she was kind of like doing both the front desk and the back end. And The problem was, she was kind of billed as being able to do all of that, but the books were actually, kind of a mess by the time I kind of realized it, which was about 3 months into the practice.
Okay. And this was 2002? Is that
Yes,
correct? Okay.
2002.
So 2002. So you hired a person, and how soon after that did you start hiring more staff? Because right now, how many do you have total?
We have about 15 full time and another like 3 or 4 that are more part time for our surgery center.
Okay. Okay. Excellent. So did you start hiring a lot after that, or was it kind of a slow process?
It's a slow process,
Okay.
yeah. But I wanted to get a few more people that were more dedicated to different jobs rather than one person trying to do it all because, in general, most people can't do everything well. It's better to, have people specialize in different areas.
That makes sense. Leverage, right? I mean,
Yes.
it's just a smart concept in general. So with plastic surgery, there are obviously lots of different avenues to take. Obviously, it is also evolved as far as the type of procedures you're doing, invasive and non-invasive, right? So is there anything that you'd say is your specialty?
Well, I mean, I'm still a surgeon mostly, so I'm still more into the surgical aspects of it. But we do have a full like med spa where we offer a lot of the newer non-surgical procedures are minimally invasive. But surgically, we do a lot of like mommy makeovers, which would be both dealing with the breast and the abdomen,
Is that a
and
tummy tuck?
could be a
is that
tummy tuck,
okay?
it could be breast lift, breast augmentation, breast lift with augmentation, but kind of doing all of that typically in women after their children, because there could be a lot of changes. But it's also, we do a lot of patients that maybe are in their 50s and even 60s that need, that have concerns in both those areas, and we do all of that.
Wow. Is the mommy makeover, is that becoming more and more popular? Are you seeing growth in that area?
Yeah, definitely. There's a lot in that area, and it's nice to kind of get all of that done at one time. It's a long surgery, but then they tend to stay overnight with us. We have a center where they can recover with a nurse staying with them overnight, so it's a little safer to kind of monitor them that way.
How long is that surgery usually on average?
It's anywhere from 7 to 8 hours.
Okay, that's a
surgery.
long day for you standing doing surgery, right?
Yes.
So what is the recovery after that? How long does it take before the patient starts to feel like where they could do normal things again?
I would put it at about a week to 10 days. You're
Okay.
not doing anything strenuous, but you're probably up to standing upright because initially after like a tummy tuck, you tend to be a little hunched over.
Well, you're tight, right? Is that the
Tight,
rate? Yeah, I would
yes,
imagine
yeah.
so, yeah.
And so, but by about a week, most people have kind of gotten more upright and start feeling more like themselves. But it's around 3 weeks, I would say, is when you really feel like you're back to normal. You can start doing more strenuous activity around 3 weeks.
Okay, so let's go back 20 years ago when you started practice here. Roughly, what percentage of your practice would you say was more surgical versus non-surgical?
Oh, it was outside of Botox. There was almost actually in 2002 is when Restylane first got FDA approved. So before that, there was only collagen, and collagen did not last at all. It was like maybe 3 months, if that sometimes. So collagen was not a very popular facial injection. Restylane kind of rewrote the whole scenario, and that was the first FDA approved one in America. So that combined with Botox, that was really the main like non-surgical. So otherwise, it was 100% surgical.
That's what I would imagine.
Yeah.
Then it's evolved over time. So what's the difference between Botox and Restylane then?
Okay, so Botox is more of what they call a neuromodulator, and that weakens muscles so they don't create a wrinkle. And so that's more of a preventative procedure. So it's good on what's called a dynamic wrinkle, which is a wrinkle that's not really there at rest, and then it forms. And so if you can stop a dynamic wrinkle, it will never become a static wrinkle, and that's a wrinkle that's there all the time.
Okay.
So when you get to wrinkles that are there all the time, you may need a filler or some kind of resurfacing to the skin. So Botox and basically sunscreen are really the only preventative things that we can really do. Outside of that, everything else is more corrective. So using fillers for different reasons. So that the amount of fillers have really exploded over the last 20 years.
I'm sure they have.
Starting just with Restylane, and then from that, there's different ones that are formulated for different reasons. So there's finer ones that are more for very superficial in the skin for very fine lines and wrinkles. And then there's some thicker ones that are meant to be injected very deeply, like against the cheekbones, to kind of give volume back. And so they can all be used kind of in one patient, depending on the different needs that they have.
Interesting. So I would imagine your practice is a little bit different. So it's changed. So there's probably a lot more non-surgical, right? I mean, any idea? I mean, is it kind of half and half, or is it still more towards the surgical part still?
Well, I did bring in a physician extender who's a physician assistant. And by doing that, I was able to kind of give up a bit of my injection practice
Sure.
and non-surgical practice and then still stay with the surgeries. So I feel like, my time's probably better spent doing surgery. That's what I trained for so long. So we have a very busy medical spa, and I still do the injections, and I still am a speaker and trainer for Allergan, who's the maker for Botox and Juvederm and those fillers. But with I think our overall practice is probably 50-50.
Okay.
Yeah.
So for women, what is the most popular procedure that you're seeing now? I guess surgical and non-surgical.
Okay, yeah. So non-surgical would still be Botox by far.
Sure.
And then that's followed closely by fillers, like Juvederm. So there's a whole line in that, and Juvederm fillers, and then the Restylane fillers.
Is there anywhere specifically where the fillers are more popular on the face?
Well, in the lips, obviously, is a very popular
Sure.
area. The cheeks have really become much more popular because when Restylane as well as Juvederm were first FDA approved, they were really only approved for the nasolabial fold. And that is a fold or a crease that's kind of between your nose down to the corner of your mouth. And that fold is, it's unsightly, but it's not actually a place that you're losing volume. It's actually you're losing volume behind that on your cheeks, and then the excess skin kind of falls down and creates a bigger fold at that area. So filling that in kind of masks it, but it's not actually addressing the problem, and it's not really where we naturally have volume.
Sure.
So sometimes people are getting kind of overdone there, and you could almost look a bit simian or like an ape.
Yeah.
And so it's nice that now there's these thicker ones that are actually used further out. And what's been shown too is by doing those fillers out on the cheeks, it makes big improvements to the nasolabial fold. You don't need to put as much or, if at all, any filler in that area.
Wow. Okay.
Yeah, so.
And surgical, is it more the mommy makeover and breast augmentation type of?
But there's a mix in the breasts. There's plenty of people that I see that actually end up having their breast implants taken out just because either, they've aged some and maybe they've gained some weight, and sometimes it's just not where they are in that stage of life. So a lot of times we could even be taking them out, doing a lift, and kind of just making everything, look a little more like age appropriate in some ways.
More natural, I would imagine.
Yes,
so you're
yeah.
actually taking them out, you're not putting anything back in, and you're just doing more of a lift?
Yes.
Okay.
A lot of times we do that. But, and we still do plenty of breast augmentation. So it's both in and out. I guess it just depends on the person.
Okay.
And then obviously facial rejuvenation is pretty big down here in Naples, Florida.
Sure.
We do a lot of both, facelifts as well as necks and eyes and brows. So there's all of that as well.
Now let's move over to the men. Okay. So most of us, when we think of plastic surgeons or plastic surgery, we think of women, obviously. But everything I read tells me that's changing quite a bit. So what are you seeing? I mean, are you seeing a large percentage of men now coming to your practice versus 20 years ago? And if so, what are they having done?
Yeah, I would say that's definitely picked up a lot. I mean, it's still obviously a predominance of women in the practice, but we're probably to like 15% maybe male at this point. And non-surgically, again, it's going to be the same things. The Botox, that really helps.
Fillers as well for men or not as much?
Not as much,
Yeah.
but some, and it could be used, the filler sometimes used in the static wrinkles, because a lot of times men come and they've already kind of developed the deep creases in the forehead or in between the brows. And so just doing Botox alone is really not going to get rid of that. So you could do some Botox plus the fillers,
Okay.
and that
Okay.
helps. Otherwise, with men, there's definitely necks are very a big thing, as well as eyes. Eyes can be very aging.
So neck is it more underneath,
Yeah.
right? So what do you do? Do you inject something in there, or how does that kind of work?
Most of the time, there's too much skin to
Okay.
really do any kind of injection. So
Okay.
it's mostly doing a neck lift.
Got it.
But the
Okay.
good thing is it can be done with kind of pretty well hidden scars. And so people at conversational distance wouldn't really have any idea they had something done like that.
Okay, interesting.
Yeah.
So what would you say, being a plastic surgeon all these years, what's the hardest part of being a plastic surgeon?
Well, I would say it's just trying to make sure you're on the same page with the patient. So it's managing expectations.
Sure.
Because you want to, I always want to give the best result I possibly can to a patient, but sometimes their expectations not really realistic. And if you can talk to them, educate them as much as possible as to what you feel like you can really accomplish, then that leads to much more happy patients. So
Sure.
that can be helped through the use of 3D imaging and morphine softwares, which have really come a long way since I started practice. So that's one helpful way to kind of give them a bit of an idea of what it might look like. And so that is, just helps kind of make sure that we're both on the same wavelength.
Sure. That makes sense. What about your favorite part of being a plastic surgeon? What do you enjoy the most?
Well, I mean, it's just seeing kind of the happy patient afterwards
Sure.
is great. And, just that some people, it really makes a huge change. Some people think it's just very cosmetic and superficial, but it really leads to improvements in their like mental state, how they feel about themselves, how they see
Confidence,
the
sure.
world. Right.
Yeah, I would imagine
Yeah.
so. Yeah, that's interesting. So, from a business point of view, I mentioned before about hiring staff and all that. I mean, again, there was a lot for you to learn probably quickly. I mean, even things like marketing and all that. I mean, anybody who has a business needs to. It's one thing to be in a profession, but if no one knows you do it, right, that doesn't help. So, how has that evolved for you? I mean, do you kind of have a lot of people on your team doing a lot of those things now for you, and it just runs on its own?
Pretty much, yeah.
Okay.
I mean, initially when we came out, the internet was, just getting popular. I mean, it was pretty early stages of that. It was still a big yellow page kind of time,
Sure.
as well as print ads. And all of that has really gone by the wayside. And now it's mostly just internet, as well as doing a lot of social media,
Okay.
which, that is, I'd say I'm a little on the older side, so it's harder for me to kind of get into the whole social media side of it. But by hiring,
Our younger people who can
yes,
exactly.
exactly. So that's worked out really well, and we try to keep a really consistent branding. We've actually had the same kind of main marketing, advertising woman with us for like probably 18 of the 20 years so
Wow.
far. So,
Okay.
and that way, my wife's also very into kind of the look and the way we present ourselves in our practice. And I think it shows both in the build out that we did. We built out our office about 6 years ago, and it's just got a really nice feel to it, and it really kind of portrays what we're trying to do as a brand.
Yeah, that's terrific. Now, do you offer a consultation? So anyone listening and watching right now who's thinking, I've always been wanting to maybe have a few improvements made. I mean, how does that work? How does a consult? First of all, do you have a consultation that you offer? And second of all, what would we expect going to your office and going through that process?
Yeah, so yes, we do consultations, and many people ask if they're free, and they're actually not, because we want to make sure we have people that really want to go through with it. Of
course.
Not just super big tire kickers just want to find out something.
Sure.
So little skin in the game, I think, helps. And then two, it really cuts down on no-shows too, because we are setting aside an hour of my time, and there is, it's an hour-long process basically. Beforehand, we have you fill out like some just online paperwork and stuff that can basically all be done through the internet at this point. And then you come in and meet with basically the patient coordinator, and they try to kind of go through the health history, see if there's any kind of red flags, anything like that, and then also just get an idea of what the patient's trying to accomplish, what's their aesthetic goals. And then from that, then I would usually come in and kind of discuss that, show possible, before and after photos of patients that we've done that have had a similar procedure. If there's morphine involved, then we would, have photos taken of the patient and then possibly do some changes to the photos to give them an idea with that. If they're doing breast augmentation, we get a bunch of measurements and then even have them try on sizer implants to get an idea of the size.
Okay.
So it's a good hour-long procedure, and then at the end of it, we kind of present them with a quote on what is going to cost to do kind of the whole thing, and that includes everything, including the follow-up. And so we have follow-up for as long as it needs to be. So even with patients with breast implants, we follow them yearly until they need to be followed. So with an implant, it's not going to last forever. So I really encourage them to come back yearly, and we can keep an eye on the implants to make sure that they're still safe and intact. And we can even do imaging of them using like a high-def ultrasound, which allows us to look at the shell to make sure if it's a silicone implant, you wouldn't necessarily know that it's ruptured. So with this ultrasound, we're able to kind of see through the skin, not have to get an MRI, which is very costly.
Okay, you said it doesn't last forever. How long does it usually last?
Well, that's the internet might tell you 10 years or so,
Right.
but it's not really 10
Well,
years.
everything on the internet is accurate. I've learned that. So
Yes, Dr. Google tells you that.
Yes.
So no, it could be out to 20 years or so. I mean, the benefit of like a saline implant is it's filled with just saline, which is IV fluid. And when that does rupture, you would know because the saline just pops. It basically goes into your bloodstream.
sure.
And then you obviously know because it's deflated.
Sure.
Now with silicone, it's not going to change. It's the volume's not going to go anywhere. So it may or may not really matter that it's ruptured because nowadays they're more of a cohesive gel or a gummy bear kind of quality. So they're not real liquidy. They're more gel-like.
Okay. So it's not as harmful because I was going to say, if you don't know that it's ruptured, I mean, is that harmful? But I guess not because of what they're using.
Yeah, it depends. I mean,
Okay.
it's probably not a great idea to have something like that, but it's if you're not having any issues with it, either, the capsule, like your body forms a capsule around any foreign body. Sometimes the capsule might thicken because the implant's ruptured. And that would be kind of a sign, these have been in for 15 or 20 years and now it's kind of hardened. It would make sense then to just go ahead and have the procedure, get that out, and either put in a new one, or as I said before, sometimes you just take it out and do a lift and you move on from that.
Okay. Appreciate that. Well, listen, you have an impeccable reputation down here in Naples, Florida, and appreciate you spending time with us today, really to give a glimpse of what it's like to be a plastic surgeon and really all the options that are available to everybody out there. Last question for you. Where can our listeners and viewers find your office and how can they get in touch with you?
Okay, well, on the internet, we're just at drhasen.com, which is drhascn.com. And the office is located on Airport Pulling Road, just across from Gray Oaks.
Okay, perfect.
Yeah.
Well, listen, Dr. Hasen, thank you so much for joining us and continued success.
Thank you very much.
Thank you.
All right.